The clinician will start by testing the function of the olfactory nerve by assessing how well the patient can identify different smells. The patient looks straight ahead while the clinician occludes one nostril and places a cloth that is in directly below the other nostril. The clinician instructs the patient to breathe in and identify the smell. The patient has correctly identified this smell. Now the clinician switches sides and occludes the other nostril. She places a cloth with a different scent than the previous one directly below the other nostril and asks the patient to breathe in and identify the smell. The patient has correctly identified the smell again. The olfactory nerve appears to have normal function. The clinician will now continue by testing the optic nerve, which is responsible for vision. She will test 5 areas of vision to determine functionality: acuity, color identification, the visual field, reflexes, endoscopy. She will start with acuity. Acuity is tested using this Snellen chart. The patient will first read the chart with her glasses off, covering one eye, and standing approximately 20 feet away. The clinician instructs the patient to read the largest print in the Snellen chart and continue down the rows as the print gets smaller until she can no longer read the letters. The clinician assigns the patient a score depending on where the client stops reading. The patient is now instructed to cover the other eye and repeat the process. This patient scores 20/20 in her right eye and 2200 in her left eye. Now the patient will read the chart with her glasses on. She covers one eye again and steps back 20 feet to read the chart. She repeats the process with her glasses off. The patient's score remains the same, with 20/20 in her right eye and 2200 in her left. Her left eye exhibits severe impairment without glasses and is still impaired even with the assistance of glasses. The clinician will now test the patient's ability to identify color. She uses Ishihara plates to see if the patient can identify pictures of numbers made up of multicolored dots. First, the patient is asked to cover her left eye, in which the patient reports no issues seeing color differentiation with the right eye exposed. However, when the patient is asked to cover her right eye with the left eye exposed, the patient is able to identify the numbers accurately, but indicates that the task is difficult because the colors are less vibrant. Next, the clinician tests the patient's visual field. Both the examiner and patient will sit across from each other. The clinician will instruct the patient to take her glasses off and cover her right eye. The examiner will take her finger and wave it while moving it slowly across her 4 visual quadrants. She has told the patient to keep her head facing forward and signal when the clinician's finger comes into her field of vision. This patient is demonstrating inconsistent responses, which indicates gaps in the visual field, and this is a major indicator of optic nerve damage. Further testing will need to be done to further examine the magnitude and severity of the gaps in her field of vision. The process is now repeated with her left eye covered. Next, the clinician will check the patient's reflexes. The patient will cover one eye as the clinician shines a flashlight into the uncovered eye and checks for pupil constriction. The clinician repeats the process with the other eye. Lastly, the clinician will examine each eye and pupil using a fundoscope. She is looking to see the structures internally within the eye and is looking for signs of glaucoma, such as cloudiness. The clinician is concerned about what she sees and will refer the patient to an optometrist for further evaluations concerning visual acuity and the visual field, as this patient is showing several indicators of optic nerve damage. Next, the examiner looks at cranial nerve 3 and 4 functionality. This is observed with a swinging flashlight test, in which the light is moved from the normal right eye to abnormal left eye every 2 to 3 seconds. Here, the affected eye shows pupil dilation as opposed to expected constriction when exposed to light. In today's examination, cranial nerves 3 and 4 will be tested simultaneously. Smooth pursuit, in which the examiner has the patient follow an object moving across the visual field, is important to assess, as impaired smooth pursuit can be indicative of neurological conditions such as Parkinson's disease. In this examination, the patient is able to follow the object, but reports difficulty seeing its fine detail and difficulty seeing the object as it moves in and out of her line of vision on the left side. In the next test, the examiner holds up 2 targets spaced far apart. She asks the patient to switch eye contact between each target. This measures CODS, or one's ability to rapidly fixate one's eyes. Observe as the examiner asks the patient to look right and then left. Here, the patient reports difficulty being able to see the target on the left side with clarity when moved closer to her right field of vision, but she is able to switch her eye fixation. Overall, the patient's extraocular movements appear intact and will be further examined with the cranial nerve 6 tests. Next, the clinician will test sensation in the patient's face to determine if there is a deficit in the trigeminal nerve. She will instruct the patient to close her eyes and using a cotton ball will touch all 3 divisions of the trigeminal. The patient will feel the clinician touching all 3 divisions, but if she did not, there would be damage to the trigeminal nerve. Doing the same thing with a pin, the clinician will gently prick each division to determine if there are any differences in sensation felt. Lastly, we will test motor abilities. The clinician will tell the patient to clench her jaw to observe symmetry, and then move the jaw side to side with resistance of the clinician's palm. If there's paralysis, then the side will not move laterally. Then the clinician will test functionality of the abducens nerve. This is generally tested in combination with the ocular motor and trochlear nerve described above. The clinician will hold a pin in front of the patient's face and tell them to follow the movement of the pin with their eyes without moving their head. This is done to detect loss of vision, blurring or double vision, which is called diplopia. This patient tells the clinician that she has trouble following the pin on the left hemisphere of her space because it moves out of her line of vision, but in fact is in her line of vision. She will also tell the clinician that there is pain when moving her eyes. This indicates that there is damage to the nerves of the eyes. Now the clinician will examine functionality of the facial nerve, which is responsible for the ability to make facial expressions, taste for the anterior 2/3 of your tongue, and sound sensitivity. We will first test the strength of the muscles that innervate the face. The clinician will test this by having the patient smile, raise their eyebrows, scrunch their face, and puff their cheeks. If the patient is able to do all of these tasks sufficiently, there should be no ipsilateral paralysis of the face. Next, the clinician will test the patient's ability to taste from the anterior 2/3 of the tongue. This is done to detect ipsilateral loss of taste from the anterior 2/3 of the tongue, or aquasia. The clinician will have the patient close their eyes and have her try various foods with distinct tastes. The patient will be given something sour, salty, and sweet to see if she can correctly distinguish between these tastes. The patient correctly identifies all tastes. Lastly, the clinician will evaluate the muscles that innervate the stapedius to ensure there is no paralysis of the stapedius causing acute hearing loss. When asked by the clinician, the patient reported no problems or discomfort with the sensitivity of their hearing. Next, the clinician will test the sensation of the patient's hearing and equilibrium. This will determine if the vestibulocochlear nerve is functioning properly. The clinician will first have the patient stand up on one leg with their eyes closed to test the patient's ability to balance. Secondly, we will test the patient's hearing ability by the standard hearing test. The clinician will instruct the patient to raise their hand when they hear a beep on each side. The assessment of the glossopharyngeal nerve will be done by testing the patient's gag reflex. The clinician will stick a cotton swab into the patient's mouth, and the patient should display a gag reflex. Then the clinician will assess a patient's ability to taste the posterior 1/3 of their tongue. The clinician will take a flavored tongue depressor to see if the patient can accurately identify the flavor. To assess the vagus nerve, the clinician will have the patient open their mouth and stick out their tongue. They are looking for an atypical uvula. If the uvula deviates to one side, there may be damage to the vagus nerve. Next, the clinician will have the patient turn her head and look at the wall. She will have the patient also shrug her shoulders. She is looking to see if the muscles of her neck are being innervated by the spinal accessory nerve. Next and last, the clinician will check tongue movement. She will have the patient stick her tongue out and move it from side to side and up and down. The patient is able to move her tongue in all directions.